Did you know that pancreatic cancer often develops without warning signs? By the time symptoms appear, it may already be in an advanced stage, making it one of the deadliest cancers out there, especially for seniors over 60. But here's something they don't tell you. There are subtle symptoms that can help you detect it early. That's what we're talking about today. I'm going to share 8 critical symptoms of pancreatic cancer that are often mistaken for other, less serious health issues. If you catch these symptoms early, it could literally save your life. If you're experiencing any of these signs, or if you know a loved one who might, this video could make all the difference. You don't need to panic, but you do need to be aware. So stay with me and let's uncover what you need to know. Section 1. Why pancreatic cancer is so dangerous for seniors. Before we dive into the symptoms, it's crucial to understand why pancreatic cancer is such a threat, especially for people over 60. You see, the pancreas is hidden deep within your abdomen, behind your stomach and intestines. It plays an important role in digestion, producing enzymes that help break down food and producing insulin to regulate blood sugar. Because of its location, pancreatic cancer often goes unnoticed until it's more advanced. This is why pancreatic cancer is so dangerous for seniors. Many of the symptoms are non-specific, meaning they can be attributed to other common issues that affect older adults, such as digestive problems, fatigue, and weight loss. Additionally, older adults tend to dismiss symptoms or attribute them to the normal aging process. However, ignoring signs like unintentional weight loss, fatigue, or digestive discomfort can have serious consequences. Section 2. Symptom number 1. Abdominal or back pain that worsens after eating. The first symptom we're talking about today is one that many people experience, abdominal or back pain, but it's often misinterpreted. You might think it's just indigestion or muscle strain, but pancreatic cancer can cause deep, gnawing pain that gets worse after eating. So, why does this happen? Well, pancreatic tumors often press against surrounding organs and tissues. If the tumor is near the tail of the pancreas, it can cause pain in the upper abdomen or back. This pain is dull, deep, and persistent, often worsening after meals. The reason it gets worse after eating is that the pancreas is more active during digestion, and a tumor can increase pressure in the area. When to worry. The pain is persistent, meaning it doesn't go away after a few hours and may last for days or even weeks. The pain worsens after eating, especially after fatty meals. The pain radiates to your back, which is a key characteristic of pancreatic cancer. The pain gets better when you lean forward, which is a sign that pressure on the pancreas is alleviated by changing your posture. If this sounds familiar to you, it's crucial that you bring it up to your healthcare provider. Don't dismiss it as something harmless. It could be a signal that your body is fighting something more serious. Section 3. Symptom number 2. Jaundice. Yellowing of the skin or eyes. Another important symptom to watch for is jaundice, the yellowing of the skin or the whites of your eyes. While it might seem like a harmless sign of fatigue or liver trouble, jaundice can be a critical indicator of pancreatic cancer. Here's why. The pancreas is closely connected to the bile ducts, which help carry bile from the liver to the intestines for digestion. A tumor in the head of the pancreas can block these bile ducts, causing bile to back up into the liver and then into the bloodstream. This leads to yellowing of the skin and eyes, a condition known as jaundice. Jaundice often appears gradually, starting with the eyes before moving to the skin, so it's not always immediately obvious. Watch for these signs. Yellowing of the eyes, whites become yellow. Yellowing of the skin, especially on the face and palms. Dark, amber-colored urine, a clear sign that your liver is producing excess bile. Pale or clay-colored stools, which happen when the bile can't get into the intestines. Itchy skin. Jaundice can cause severe itching, especially in the hands and feet, without any visible rash. If you notice any of these signs, it's essential to see your doctor immediately. Jaundice isn't something to ignore, as it can indicate serious liver or pancreatic issues. Section 4. Symptom number 3. Light-colored, greasy, or floating stools. Another symptom to be aware of is digestive changes, particularly light-colored, greasy stools. This symptom can sometimes be mistaken for other digestive disorders, but it is important to recognize it early. When pancreatic cancer interferes with the pancreas's ability to produce digestive enzymes, the body can't properly absorb fats from food. This leads to greasy stools that float and may be difficult to flush. They often have a foul odor and may cause excessive gas or bloating after eating. This symptom is often called steatorrhea, and it's one of the earliest signs of pancreatic cancer that people tend to overlook. What to look for? Stools that are pale or clay-colored, which indicates a lack of bile in the stool. Greasy or fatty stools that leave an oily residue in the toilet. Stools that float or are difficult to flush, often with a strong odor. Excessive gas or bloating after meals, even with small portions. If this is happening to you, it's important to discuss it with your healthcare provider. It's one of the symptoms that can point directly to a problem with your pancreas. Section 5. Symptom number 4. New or worsening diabetes. Now this is something that may surprise you. Pancreatic cancer can trigger diabetes or make existing diabetes much harder to control. The pancreas plays a key role in regulating blood sugar through the production of insulin. When pancreatic cancer affects the cells that produce insulin, it can lead to new-onset diabetes, especially in older adults who've never had issues with their blood sugar before. This is a critical sign for seniors to be aware of, as many people experience difficulty managing blood sugar levels as they age. Signs to watch for: new-onset diabetes in seniors, especially those who have never had trouble with blood sugar. Uncontrolled blood sugar levels, even with medication or lifestyle changes. Increased thirst and frequent urination, common symptoms of high blood sugar. Fatigue or feeling unusually tired, even after rest. If you've recently been diagnosed with diabetes or are noticing significant changes in your blood sugar control, it's time to talk to your doctor. Don't just assume it's normal aging. Section 5. Symptom number 4. New or worsening diabetes. Now this is something that may surprise you. Pancreatic cancer can trigger diabetes or make existing diabetes much harder to control. The pancreas plays a key role in regulating blood sugar through the production of insulin. When pancreatic cancer affects the cells that produce insulin, it can lead to new-onset diabetes, especially in older adults who've never had issues with their blood sugar before. This is a critical sign for seniors to be aware of, as many people experience difficulty managing blood sugar levels as they age. Signs to watch for: new-onset diabetes in seniors, especially those who have never had trouble with blood sugar. Uncontrolled blood sugar levels, even with medication or lifestyle changes. Increased thirst and frequent urination, common symptoms of high blood sugar. Fatigue or feeling unusually tired, even after rest. If you've recently been diagnosed with diabetes or are noticing significant changes in your blood sugar control, it's time to talk to your doctor. Don't just assume it's normal aging. Section 7. Symptom number 6. Nausea, vomiting, or bloating. Digestive discomfort is something many people over 60 experience, but when it becomes persistent or worsens after eating, it may signal a deeper issue with the pancreas. One of the less obvious but very telling signs of pancreatic cancer is nausea and bloating, especially after meals. This happens because a tumor in the pancreas can obstruct part of the digestive tract, slowing down how quickly the stomach empties. This condition is known as gastric outlet obstruction. When food sits in the stomach longer than it should, it leads to a host of uncomfortable symptoms. Symptoms to look out for: nausea, particularly after eating even small meals, bloating or a swollen feeling in the upper abdomen, a sensation of burly fullness where you feel full after just a few bites, vomiting, especially if it occurs hours after eating, frequent belching or acid reflux that isn't relieved by antacids. Sometimes these symptoms are misdiagnosed as GERD, ulcers, or food sensitivities. But if they persist longer than 2 weeks, especially in someone over 60, they warrant further evaluation. Don't just treat the discomfort with over-the-counter meds. Let your provider know and ask for deeper investigation, especially if paired with other signs we've discussed. Section 8. Symptom number 7. Depression or sudden mood changes. This one might surprise you. Depression can be an early symptom of pancreatic cancer. Now, we all understand that emotions fluctuate with age, loss, or chronic illness. But pancreatic cancer has been shown to trigger biological changes in the body that can directly affect mood and mental health, even before physical symptoms emerge. Scientists believe that cancer-related inflammation, along with the hormonal and metabolic disruptions caused by a pancreatic tumor, can impact brain chemistry. This can lead to depression, anxiety, and a feeling of emotional withdrawal that seems to come out of nowhere. Emotional signs to pay attention to: feeling down, sad, or hopeless without a clear cause, loss of interest in hobbies or activities once enjoyed, withdrawal from friends or family, increased irritability, anxiety, or restlessness, trouble sleeping or sleeping too much. If you or someone you love is experiencing a sudden change in mood, especially when it doesn't seem to have an emotional trigger, don't overlook it. It may be more than psychological. It could be a physical red flag. Mental health symptoms should always be taken seriously. And when they appear with digestive or physical symptoms, it's time to advocate for further testing. Section 9. Symptom number 8. Blood clots or leg swelling. Let's now talk about a symptom that often doesn't seem connected at all: blood clots, especially in the legs. Many people don't realize that pancreatic cancer increases the risk of blood clots significantly. In fact, sometimes the first warning sign of an undiagnosed pancreatic tumor is a deep vein thrombosis, DVT, a clot in the leg. Cancer, including pancreatic cancer, causes changes in the blood's clotting ability. This hypercoagulable state means the blood becomes thicker and more prone to clotting in veins, leading to symptoms of concern: swelling in one leg, especially the lower leg or calf, a leg that feels warm, tender, or painful, especially when walking, redness or discoloration on the leg. In some cases, the clot travels to the lungs, causing sudden shortness of breath, chest pain, or dizziness. If you notice any of these symptoms, especially if they appear suddenly and without injury or known risk, seek emergency care immediately. These are not only signs of possible cancer, but can be life-threatening on their own. Even if a clot is resolved, it's essential to ask, what caused it in the first place? Sometimes the answer lies deeper, and it's worth investigating. Bonus section: digestive discomfort, the sneaky symptom nobody talks about. This next one is what I call the sneaky symptom. It doesn't seem serious at first. It's not painful, not dramatic, but it's persistent, and it often starts before anything else. I'm talking about general digestive discomfort. You might feel like your stomach just isn't working like it used to. You might feel off after meals, even small ones. Or you might think you're eating less, simply because your appetite isn't what it once was. But when these mild symptoms linger for weeks or months, they become very significant. Mild but persistent signs include loss of appetite, often subtle but noticeable over time, feeling full quickly, as if the stomach shrinks after a few bites, mild nausea that comes and goes without any clear cause, burping or gassiness that doesn't seem tied to specific foods, a sense that digestion is sluggish, slow, or backed up. These symptoms are often dismissed as indigestion or aging, but when they persist, especially in someone over 60, it's time to look deeper. You know your body. If something feels different and stays different, trust your instincts. What to ask your doctor? Early detection saves lives. Now that we've gone through the 8 major symptoms, the next question is, what do you do if you recognize one or more of them in yourself or a loved one? You don't need to panic, but you do need to act. The most important thing is to communicate clearly with your doctor. Be specific about what you're experiencing, how long it's been happening, and how it's different from what's normal for you. Here's what you can say to your doctor. I've been noticing some persistent symptoms, changes in my digestion, energy levels, and appetite. I'm over 60 and I'm concerned this could be something serious, like pancreatic cancer. Could we run some tests to check on my pancreas? Ask your doctor about imaging tests like an abdominal ultrasound, CT scan, or MRI. Blood tests for tumor markers, such as CA19-9. A referral to a gastroenterologist or oncologist if concerns persist. Early-stage pancreatic cancer is often treatable, but it's rarely caught unless you demand answers early. Be proactive. Be persistent. Your health is worth fighting for. Conclusion: don't panic, but don't wait. Let me end with this. Most of the symptoms we've talked about today, abdominal pain, weight loss, fatigue, digestive issues, can be caused by a dozen other conditions that are not cancer. But that's not a reason to ignore them. It's a reason to stay vigilant, especially as we get older. Because if pancreatic cancer is caught early, there is a real chance to beat it. The only way to do that is by paying attention to your body and speaking up when something feels off. So if something here resonated with you, or reminded you of someone you care about, don't stay silent. Share this video, leave a comment, and most importantly, make that doctor's appointment. Because the truth is, your life may depend on it.